What are anti-epileptic drugs for brain tumor patients? Have you ever wondered how brain tumor patients manage seizures? Anti-epileptic drugs, or AEDs, play a crucial role in this process. These medications help control seizures that can arise as a complication of brain tumors, a condition known as brain tumor-related epilepsy. Research shows that more than half of brain tumor patients may experience seizures at some point during their illness. Typically, AEDs are prescribed after a patient has experienced a seizure rather than as a preventive measure. This approach is particularly important in the context of brain tumor diagnosis and treatment, especially during post-surgical recovery. Surgical options, along with therapies like radiotherapy and chemotherapy, can impact how well seizures are controlled. For instance, in cases of low-grade gliomas, effective anti-tumor treatments often lead to improved seizure outcomes. Current medical guidelines suggest starting AED treatment only after the first seizure occurs. Using AEDs before any seizures happen, known as prophylactic use, is generally not recommended. Evidence does not support this approach, and long-term use of these medications can lead to side effects, including cognitive impairment and social difficulties. Among the various AEDs available, second- and third-generation drugs are often preferred due to their lower risk of drug interactions and side effects. Levetiracetam is commonly recommended for brain tumor patients. This medication is favored because it does not significantly interact with chemotherapy or other treatments, generally preserves cognitive function, and has a good safety profile. However, it is important to monitor for potential psychiatric side effects in some patients. If levetiracetam alone does not effectively control seizures, doctors may consider adding other AEDs like lacosamide, perampanel, or valproic acid. In cases where patients are nearing the end of life and oral medications are difficult to administer, benzodiazepines can be used as alternatives for seizure control. The duration of AED therapy after surgery or seizure control is tailored to each individual. Typically, if no seizures occur, prophylactic AEDs may be stopped within about 1 week after surgery. Long-term use of AEDs is reserved for patients who continue to experience seizures. Decisions about whether to continue or discontinue AEDs take into account factors like seizure control, the completeness of tumor resection, electroencephalogram findings, and the patient's lifestyle. In summary, anti-epileptic drugs are essential for managing seizures in brain tumor patients. Levetiracetam is often the first choice after a seizure, with other medications available if needed. Prophylactic use of AEDs is not supported by evidence, and treatment duration is personalized based on individual circumstances, especially during recovery after surgery. Always consult healthcare providers for tailored medical advice to balance seizure control with quality of life and potential side effects.